The United States of America invests heavily in healthcare. We're known for a really high chronic disease burden.
We don't think about health until we don't have it. So we really need to rethink how we consider health and healthcare. It's the choices that you make today that are going to impact how you do later in life. That's kind of the challenge. It's not about where you are a month from now. It's where you are 3 years from now, 10 years from now.
How do those effects add up, and how can we remind ourselves?
We often don't educate people about the impact of processed foods. So that's a real challenge of diabetes, cancer, heart disease, stroke. So it's really helping people to make that connection between food and their overall health.
There's this sense of urgency. I need guidelines that I could put in, say, this afternoon that lead to better health and not worse health.
The good news, Matt, there's a lot of encouraging technologies that can help consumers make healthy choices.
You can't be there with your patient every moment of the day. You have the chance to potentially change their lives.
It's about offering choices, helping it empower people. So find out what you enjoy.
That is so important. We can't possibly overstate that.
You'll get there if you're consistent.
That is absolutely wonderful. The steps that we can take to change our lives starting today.
Thanks for empowering people with information. That's what we try to do at WebMD, because if you have better information, you're going to have better health.
Today, I'm happy to welcome Dr. John Whyte, Chief Medical Officer at WebMD and one of the leading medical education voices in the U.S. How are you, Dr. Whyte?
I'm well, Matt. Thanks for having me today.
Thank you so much for joining us. The United States of America is a land that invests heavily in healthcare for its citizens. We're known the world over for bearing a really high chronic disease burden. There's not a family in the U.S. that hasn't been touched by some of the common chronic diseases. What are some of the biggest chronic diseases that Americans face?
Well, Matt, you touched upon it, that we really are a country of chronic health problems. And, the leading causes of death: cancer, heart disease, stroke, diabetes. And these are all conditions, although there is some genetic predisposition, a lot is caused by lifestyle. Terms of what we eat, how often we're active, the quality of our sleep. So that provides us an opportunity to actually change that trajectory, but we're not doing it.
Can you talk a little bit more about the progression here? Because I think a lot of times when we have an urgent medical need, we know to rush to our local hospital or to go talk with our doctor. But can you talk a little bit more about the insidious nature of these chronic health problems and how easy it is to miss them until it's too late?
Now, I know you're very active on social, on Instagram and some other platforms. And I recently posted on social the concept that we don't think about health until we don't have it. And then all of a sudden, we're very focused on that acute care. And that's part of the problem. We have an acute care system, one that's not focused on prevention. So when we have chest pain, you should immediately call 911 and go to the emergency room. But we should be talking about how to prevent or delay that in the first place. And the other issue that you and I are both concerned about is the issue of equity. Everyone doesn't have access to great healthcare, and they're using the emergency room for primary care, where it really should be used for acute care. So we really need to rethink how we consider health and healthcare.
What would you say to your average 25 to 45-year-old, right, who is still in that phase of life where they're feeling kind of invincible. They might know a parent or a grandparent or somebody who has faced perhaps cancer, hypertension, or diabetes, but who feels that they're kind of out of the reach of any of these chronic health problems.
And Matt, I would say that's a big range. So instead of 25 to 45, I might say 25 to 35, because as you're approaching 40, you're starting to experience some of those health conditions, typically high blood pressure, high cholesterol, some joint pain issues. But you're right. When you're 25 and 30, you're thinking about starting a family, having progression in your career. You're not thinking about conditions that might impact you 20, 30 years later. But what I try to tell people, it's the choices that you make today that are going to impact how you do later in life. And let's also be honest, particularly men in their 20s and 30s and even early 40s, they don't come in to the doctor unless they have a specific health issue, whereas women will come in for issues of OBGYN. So they're still getting some care or some interaction with the healthcare system, but others aren't. And I'd like them to focus more on healthy eating, right? There's a great phrase that says, show me what you eat and I'll tell you who you are. And that really is this concept of food as medicine, and to encourage people to be active. That's kind of the challenge. And, now when people are trying to get in shape for the summer, I say, it's not about where you are a month from now. It's where you are 3 years from now, 5 years from now, 10 years from now. But it's hard to get that attitude when you're in your 20s or 30s and you're healthy, as I hope we are, with no health conditions.
So the typical experience that an American has when you drive through and you're in a hurry and you go get yourself a quick meal and you pay $1 or $2 and you're handed, say, 32 or even 64 ounces of a really hyper sweetened beverage like a soda. Give us an idea of just how significant this is. As a chronic exposure, this is something you kind of rely on a couple times a week, or even for many working Americans as a daily lunch activity, especially in comparison to other first world countries. Because I think a lot of times we have this confidence that we're in the American system. We have wonderful acute care, like you mentioned, but for a European who might order a soda and get a tiny little 4 or 6 ounce glass, mm-hmm. as opposed to that 32 ounce or 64 ounce soda every single day, how do those effects add up? And how can we remind ourselves of just what kind of a risk this actually adds up to?
And in Europe and other areas of the world, eating really is an experience. Right? You do it with your family and loved ones, and you take a fair amount of time to do that. Just go to, any restaurant in Europe, or, a family member in Europe. The dinner is like 2 hours, 2.5 hours. and you'll also notice the plates are much smaller. I've noticed that in Europe, either at breakfast or other meals, you don't have these big buffet plates that you typically see in the US. But the problem, Matt, is that we often don't educate people about the impact of processed foods and ultra processed foods, which are much of the fast food industry. But there's also the issue of cost. I've had patients tell me, and rightfully so, that ordering something at fast food off what used to be the $1 menu, or maybe it's $2 now, is going to help get their kids full, as opposed to if they have to buy fruit or salads or things like that, and their kids don't like that. So that's a real challenge too, as to how do we make healthy food affordable? So it's an equal choice between things. That's a big issue. And you often don't associate what you eat with your health conditions until you develop the health condition. And then you realize the impact, particularly in diabetes. And then, as we know, despite the amazing advances we've seen in weight loss drugs, we still have a huge problem with obesity. And the impact of obesity and all the conditions we mentioned at the beginning of diabetes, cancer, heart disease, stroke. So it's really helping people to make that connection between food and their overall health.
Let's say that we're talking to somebody who has a sort of vague understanding that there is a connection between food and health. Perhaps one of the many millions of Americans who's getting told, hey, you're pre-diabetic, or unfortunately, you've already entered the diabetes range. And there's this sort of sense of urgency. I need to start eating healthy, right? I need to start eating healthy means I'm not sure. I need to start watching my sugar, which means I'm not sure. A lot of times the experience that patients have and the experience that we have as providers is there's this very sort of awkwardly rushed, maybe 10, 15, 20-minute office encounter where the physician tries to convey to the patient what it means to watch their sugars. How do we boil this down to real life practical advice that I, as the patient, can take home and actually use to change the way that I'm eating? What are some guidelines that I could put in, say, this afternoon to start making choices that lead to better health and not worse health?
And I know you're the interviewer, Matt, but I'm going to ask you a question, if I may. How much time in your medical school curriculum is spent on nutrition? Probably very
tragically little. It's a revolving conversation that we talk probably more about the negative health outcomes from poor diet than we educate our medical students on what a good diet actually is.
So I would push back when you say, in that 10, 15-minute appointment, the doctors are trying to say the impact of too many carbs or, too much fat on one's health, because most physicians don't talk about that, don't really understand how to educate patients about nutrition and what healthy nutrition means. So then it can be complicated. What to do? Do you do keto? Do you do paleo? Do you do intermittent fasting? Where do you look for information? But the good news, Matt, I'd say there's a lot of encouraging technologies, particularly digital tools, that can help consumers make healthy choices when it comes to what they should be eating. There's apps where you literally can take pictures of your food before you eat it, and it will tell you how much carb, how much fat, how much protein, and is it a good choice or bad choice? So I will tell you, as a physician who's interested in healthy eating and lifestyle, I can't always tell how much carbs or fat or protein something has. That's not how we live. I've never counted calories. We can use tools that can help us learn whether we're burning carbs or fat, and that can help guide nutrition. We can try a continuous glucose monitor to see, how certain foods impact blood sugar. So I'm kind of a little bit disappointed in how the health profession, in terms of doctors and nurses and pharmacists and PAs and nurse practitioners, are doing in terms of educating consumers, patients about health. I wish they would. I mean, what do doctors say to patients? You need to lose weight. You need to eat healthy. You need to go to the gym. That's not useful advice.
It's an outcome rather than a path to walk. And that really is the problem. Rather than saying, hey, patient, we need you to set off on these steps, we're saying we need you to arrive at this destination. We need you to achieve weight loss or a hemoglobin A1C that is lower by this many points. Right. And it's like saying, hey, we need you to arrive at this address in another city you've never been to. It doesn't provide the path forward. I love that you have mentioned some of the apps and sort of mobile technologies of the 21st century that I think are underutilized. If any providers happen to be listening to this, please don't forget, you can't be there with your patient in your patient's pocket every moment of the day. But guess what? Their cell phone will. Yeah. And if you have a chance to convince, even while your patient is in office, to convince them to get that kind of app that makes it very, very easy to just become conscious, even if they can only commit to using it for the next week, right? This doesn't have to be, hey, you're going to log everything you eat for the next 3 years. If you can even get them to become conscious of kind of what they eat for the next week, you have the chance to potentially change their lives. We get patients in the office who are frustrated with their lack of weight loss. And sometimes the conversations are really shocking. We say, can you just keep a diary
Yeah.
on your phone, on an app of your food and your beverage intake? Can you tell us a little bit about why some of our patients are really shocked about the impact of beverages, when a lot of times we think, I need a calorie count, I need to
They
outlaw
forget how many calories are in, a beverage, the sweetened iced teas, the lemonades,
in the salad.
the iced, yes, the iced frappuccinos and cappuccinos. But I often do tell patients to try to do a food diary for a week. But what I do, Matt, is I ignore the first 2 days, because often people will try to please the doctor or make changes so they have a good report. And that's not what we want. We want what their average issue is. And there's lots of research that shows people vastly underestimate the amount of food they consume during a day, because we tend to be a nation of snackers. And we often don't consider that when we're thinking of the total calories that we consume.
When we wake up and we're surrounded by the food culture of not just our country, but our home environment, what are some steps that we can take to create an environment that really influences us in the right direction, starting at home, that will give us sort of the footing to be successful?
Yeah. Well, part of it is what's in your pantry and what's in your refrigerator. I'm always surprised by people when we talk about they're trying to, say, reduce the consumption of candy, and that they still buy a lot of candy. And sometimes they'll say, well, that's because my spouse likes candy, or it's for my kids, or whatever. And that's hard to do in a family when you all don't have the same perspective of food and trying to make the same healthy choice. So in some ways, you have to get the entire family on board. Another key element is you really have to, as I said, stop buying the foods that you're trying to avoid, because it's very hard to eat, healthy when you have a lot of chips and processed foods in your pantry. And when you're hungry, you're going to eat what's available. So if you only have oranges and bananas and grapes, you might eat those, versus if you have ice cream, you're likely to always choose that instead. So that's an important component as well.
And that bears repeating. What is available is going to be your go-to. If you have a cabinet full of chips and cookies, that is going to be available to you when you are craving it. And if you don't purchase those things, that simply won't be available. And I can't emphasize how much of a difference this would make if we could start off on the right foot. What kind of guidance do you offer for having those family conversations? Because this is one of those under-discussed components.
Yeah.
When we have a food culture in a family, maybe you've been eating a certain way for 15, 20 years with your partner or with your children in the home, and you decide it's catching up to me.
Right.
But I can't make my family change. How do we even begin to navigate that?
I've seen different approaches. I have seen people be successful where they have cooked different meals, or you've cooked your own meals with different spouses, or you cook something different for you versus than your kids. If that works for you, although that may be more effort, then that's okay, as long as you're eating healthy and meeting your goals. And then I think it's about having a family discussion about what the goals are of the family. Food is an acquired taste. We tend to think, oh, we're pre-programmed to like ice cream and chips. And there's some back and forth on that. But in many ways, you have to introduce foods to yourself, just as you do for your kids. You would never let your kids stop eating, vegetables after one bite. They say they don't like it, right? We say you have to be introduced to something 7 times before you know whether you like it or not. So it is having that discussion, but it's also about making small changes. You don't have to change everything all at once. So something that I did for myself is I used to drink soda And then I switched to diet soda. And then I switched to sparkling water. And it was an effort. But now if I drank a soda, I'd be like, this is so sugary. It's the same thing with, I used to drink whole milk and then I switched to skim. And now if I go back to whole milk, I'm like, it's like drinking cream. So it does take an effort. It doesn't happen overnight. And I really encourage people to maybe just start with beverages too, as you pointed out, because we consume so many calories by drinking too much. And that's not just alcohol, but just, these sugary sweetened beverages. I changed to just regular coffee rather than, the multi.
Someone's out there who's listening, who's driving through and getting a Frappuccino or some 45-gram sugar latte every morning. This is you simply finding a way to get less sweetened or unsweetened caffeine in the morning. If that is your vice, that is going to make an aggregate difference of hundreds of grams a week. For some of you, if you're in the South and you're going through some of our local coffee establishments, there are drinks that you're downing every day that are over 100 grams of sugar. And that really does add up. Literally.
What's your beverage? What's your beverage of choice?
I drink a large black coffee with a little shot of oat milk, but I don't do a drop of sweetener in it because as a medical student, I drink a lot of coffee. And if I had sugar in it, that would be a very large aggregate sugar intake. So for me, since coffee is my beverage of choice, I just don't sweeten it. But that required training too, because when I was a 21-year-old, you better believe it was the mocha this and the vanilla that, and it really adds up.
So mine is very similar. So as I mentioned, I do drink a lot of sparkling water, regular water, as opposed to other beverages. But in the morning and maybe early afternoon, I've switched to as you do, a regular coffee. I use 2% milk, but I don't use any sweetener. And I've come very much to enjoy that. But that's something that I've learned over time.
If you're out there and you're listening, there's a drink or a food item that's popping into your head where you're like, that's my daily hit. I don't know if I can give it up. Kind of getting there step by step and committing to not going backwards for a good 90 days or something. There is a time window when you will discover you can reset your palate. Even for the person who says, well, since I was 7 years old, my parents gave me sweet tea. You can still reset your palate. It does take time. It also takes time, we're learning, in part because of the sort of reinforcing effects of things like the gut microbiome. And Dr. Whyte, this is something that's gaining more and more attention across social media and in the medical literature. The effects of the gut microbiome on health, on cancer, on your risk of everything from cancer to cardiovascular disease. When we introduce this idea that our patients need to not just be counting sugar, they also need to be aware of their sort of baseline fiber intake. A lot of times we get kind of a blank stare. What kind of foods are high in fiber, and what does that mean? How can we sort of what it means to eat a healthy amount of fiber, and what kind of foods can we look for that in?
I love this, Matt, because if I talk to people that, have heart disease, about healthy eating, there's some attention to that. Certainly diabetes, talk about it. But when I bring up the gut microbiome, this is something I've seen over the last few years. Most patients are very interested in learning about it. And as you talked about the role of the gut in immune function, the role of our gut in essentially being a second brain, which we don't realize that we didn't talk about this in medical school when I was learning to be a doctor. But now we know the impact about the gut. And I find people are very interested in learning about the microbiome. Now, I will tell you, people want to hear about probiotics and prebiotics. When I talk about fiber, they're not as interested in it. But fiber is very important. And we know that Americans underconsume fiber. And what I tell people is it's about green leafy vegetables, right? It's about, having oatmeal and some other elements. But something that I do And that I tell people, people that are maybe a little bit older than me remember their parents or grandparents taking Metamucil, and they think, oh, I have to stir this orangey stuff. That doesn't sound good to get fiber. But you can buy these little fiber crisps that I actually utilize as like a cracker that's healthy. So again, when you're trying to make healthy choices, if you like crackers, a lot of people like crackers, you can find a healthy one, which are these fiber crisps. So I've made a conscious decision. I know I have to consume more fiber. So I tell people it's about certain fruits and vegetables that they have to educate themselves. But fiber has an important role in terms of blood sugar control, in terms of this concept of satiety, that it signals to my brain that I'm full, so I won't eat as much.
When our ancestors were eating food, especially before the processed food revolution, where we figured out how to make everything sweeter and lower in fiber, it was impossible to eat a lot of food without just incidentally consuming enormous amounts of fiber. We have pretty good data that possibly in hunter-gatherer societies, a consumption of 50 to 150 grams of fiber may have been the norm. And if you're ever distracted by any of the social media on the carnivore diet, any of our carnivore diet crowd out there, if you hear somebody telling you that a people group like the Hadza, modern hunter-gatherer group, was just eating meat, it is beyond false. We know in abundant detail from the anthropology that they hardly go a day without eating at least 50 grams of fiber. And yet many Americans find it hard to even hit 20 grams
That's exactly right.
of fiber. Do we have enough data that suggests that we can just fix it with a probiotic pill if we are not consuming fiber?
No. And, even with the fiber supplements, as I mentioned, which primarily are, shakes and other things that you can make, or these crisps that I talked about, you'll always want to choose whole food instead, if you can. There is no magic pill. Probiotics and prebiotics, I think they can serve a role for many patients, including, helping with the gut microbiome, the good bacteria versus the bad bacteria. But some people don't tolerate probiotics well. There's some issues of allergies for some people. But the issue is, as best as you can, especially when you're young, to make those healthy choices. Sometimes as we get older, it's harder to make those healthy choices for a variety of reasons. But controlling your microbiome is going to go a long way in impacting your health, and including how regular you are, which a lot of people can be focused on as well.
And for our listeners who are interested in having a healthy gut microbiome, keep in mind, if you're willing to drop $30, $60, $90 a month on a probiotic supplement, consider possibly using some kind of either a fiber supplement, or introducing, like Dr. Whyte said, those whole foods with the money that you could be spending on a probiotic supplement. Because a lot of times when we see those labels and they say like 5 billion units or 10 billion units or some of the really expensive probiotic supplements, we feel like this has to be really, really effective because it sounds like it's a lot. But in your gut microbiome, the number of organisms that are actually helping us out, it's really in the trillions, possibly up into the hundreds of trillions. So it's kind of a drop in the ocean. If you're
what's after trillions? It's like quadrillions.
we estimate that so if a human has somewhere around 35 trillion cells, we think somewhere around 10-fold that. So in the like 300 or 400 trillion good gut microbes are living inside if we are taking care of them. So, well, in the typical American plate, what would be a sort of good partition for a health enhancing, or rather than a health harming plate if we sit down to dinner?
Well, part of it is, how do people eat? That they don't necessarily, eat in percentages, right? So I've never been a big fan of like, okay, do 30% carbs, 30% protein and then, 20% this or that. Because I don't think that's how people think for most people. What I think in some ways is if you divide your plate in some ways, you want to have some component of vegetables. And I say that is because most of us don't include vegetables in our meals. So if you have some portion of your plate vegetables, if you have some portion of your plate some fruit, right? It could even be a few grapes, but you try to incorporate fruits and vegetables in at least two of your meals, ideally three, but at least two. And then you have that healthy protein. Maybe it's chicken, maybe it's seafood. And then you try to have some component of whole grains. That's how I, tend to think of it. And, maybe you could divide it all in fours with the vegetables, the fruits, the healthy protein, and the whole grains. A lot of folks at Harvard recommend that. But that's what I would think about in terms of how you create that plate.
Talk to me about the in between now. Well, many Americans' pantries are stocked with every manner of hyper processed, hyper sweetened, sort of refined carbohydrate product. What is a good replacement for my in between cravings? If I'm a snacker, what should I be reaching for?
And I do want to say and point out that it doesn't mean that you can never have those foods, right? Because oftentimes when you say that, if I'm going to deny you something, then you want it. It's about changing your tastes. And people can have those. They just can't have them every day. And some will even say, just focus on having more healthy days rather than unhealthy days. But what I've put in my pantry, and I've learned to enjoy it very much, are nuts, right? Nuts are a great source of healthy fat, of healthy protein, and they can help make you full. And patients will often say to me first, "Oh, Dr. Whyte, I heard nuts have a lot of calories." They do and can have a lot of calories, but you want to have it as a handful of nuts, preferably unsalted. So that's an important element. The other element is not necessarily always looking towards your pantry, but looking towards your refrigerator and what fruits and vegetables do you have in your refrigerator, right? You could create, and they have packaged hummus, depending upon where you buy it, that's, healthy in terms of using, hummus with some carrots and cucumbers. And you could even have some slices of cheese as well. So there's lots of different options that are out there. And the internet provides a lot of great options if you look carefully in terms of some healthy choices. But I would say, also look to your refrigerator as much as you look towards your pantry. The other element is I also do sometimes use these prepackaged for nuts, right? So you don't have a lot of loose things around too. Sometimes people don't like that.
Part of the American habits that lead us a lot of times to these negative health outcomes includes the fact that a big portion of the middle of our grocery stores are these hyper-processed, shelf-stable foods. And so many times from the time people are very young, they are accustomed, they are habituated to reaching for the pantry if they're hungry between meals, and simply not stocking your pantry as much. Maybe, like you said, with stocking it with things like nuts, reducing the amount of processed carbs that we have available. Maybe rewarding ourselves with a small serving of those kinds of things, maybe only buying it in that one small serving when we're ready to reward ourselves. And of course, I love that, having reaching for those fresh fruits or vegetables or hummus products or things like that instead of just going for the pantry.
As physicians, we're very judgmental, and it's about helping people make that healthy choice. So for instance, I saw a patient a few months ago, her A1C or hemoglobin A1C, your measure of her diabetes, had been going up and up and up. And I kept saying to her, "Do you eat candy? What are you eating?" She's like, "No, I'm trying to eat healthy." And then finally she's like, Dr. Whyte, I have been eating a lot of these, peanut chews. And I didn't judge her and say, "Oh, that's horrible." The first thing I said to her is, "Do they still have those? Like, I haven't seen this in a long time." So I said, "You have to think about other choices that you can make." And I didn't immediately criticize her and berate her for doing that, but talked about that's probably not the healthiest choice. Maybe some other choices. And you know what? Over the next 6 months, it took a while. She dramatically stopped buying, and she reduced it by stopping buying them. And her blood sugar has gotten under better control. Not perfect, but better. And that's okay. But I didn't judge her. I helped her make a healthier choice with some options. And those are the things that we need to be doing. Because the first response to people is, I don't like that. I had a patient a couple of years ago who said to me, I said to her, you need to replace, all your unhealthy beverages. You need to start drinking more water. And she actually said to me, I don't like water.
I can't count how many times I have heard that line, but I don't like water. And
I know what
those conversations can be open-ended. Like, what do you think you could drink that would not be as threatening?
Right. That's exactly right. Maybe it's unsweetened tea to start with. For a lot of people, just like for me, it was sparkling water that's flavored, right? That got them. So it's about offering choices, helping it empower people. But we tend to be too judgmental when we talk to people about unhealthy food choices.
We can't talk about lifestyle and diet and not mention the current semaglutide craze, the Ozempics and the Wegovy's. So before we pivot and talk a little bit about sort of physical activity and what we can do to stay active, can you tell us what place we should be thinking of for this sort of semaglutide option for weight loss? Because a ton of Americans have this on their mind right now.
I think there certainly is a role for these medications for some patients. It's not for every patient. It's not for the patient. And I've seen them who, want to lose 10 pounds for summertime or, 15 pounds for some upcoming event. It's really about people who have been struggling with obesity for a while. And what I tell them is, remember, when you lose weight, at least for these drugs, you're losing muscle as well as fat. And especially as we get older, there's a real risk of something called sarcopenia, where you're already losing muscle. And now if you lose more muscle, that might make it difficult for you in some of your activities of daily living. And the reason why I say that is taking these medications is still important to have important healthy lifestyle changes. So a patient the other day said to me, who's been successful in losing weight, I said to her, well, what have you been doing? Have you been eating, healthier food choices? She said, oh no, Dr. Whyte, I've just been eating less. So we do know that these drugs help with satiety, helping you make full, but that's not going to help her overall health profile in the long term if she still doesn't change the quality of food. So for these drugs, we still have to think about the quality of food that we eat, not just the quantity. And then we still have to have an important exercise and activity program.
And I think that bears repeating because this oftentimes in the American culture where we view medicine and the pharmaceutical options almost as a product or a service that we can buy, it's important that this isn't conceived of as a standalone product that we can buy to correct those lifestyle factors. Because especially if the drug is discontinued, you will simply continue with whatever the lifestyle, whatever the activity level, and whatever the dietary habits were from before. And of course, the health benefits may not stick around if it is discontinued. We have relatively good information from studies thus far that if it is withdrawn, especially within the context of sort of the typical American population with American activity levels and American diet, unfortunately, those benefits don't stick around. So what can we do for physical activity to make sure that whether a patient is using this as an assistant to weight loss, or if they're doing it without that, what can we do to make sure we are setting sort of realistic and attainable, but helpful physical activity goals?
Now, you're busy as a medical student. You've got a lot going on. You've got these other activities, run podcast. What's your physical activity regimen?
I include some amount of jogging 3 to 5 times a week. And I try to do strength training 3 to 5 times a week as well, because I find that if I don't incorporate that, I really just feel my energy levels down. And I feel like it's almost a shot of oxygen to keep active.
Yeah. Now, the reason why I asked that, Matt, is because when you talk to patients or talk to friends about, the American Cancer Society, American Heart Association, or CDC says 150 minutes, of exercise a week or 75 minutes of vigorous, for a lot of people that can make their head explode and think there's no way I can do that. So I'm not going to do anything. I hear that from so many people that they get frustrated. So I can't do that. And what we should be telling people is any amount to start with is good, right? So if you can only do 10 minutes 3 times a week, then go ahead and start with that, but consistently increase it over time to try to get to those goals. So instead of 10,000 steps a day, maybe you're at 3,000 to 4,000 steps right now, where most Americans are. So if you could get to 5,000 next month, that's pretty good. You get to 6,000 and 7,000 and slowly build up. And then what I've been doing and what I encourage people to do if they have a smart device is look at the calories burned. Now, these are not medically grade, but they're still pretty good, right? So you want to see your heart rate increased and you want to see your calories burned, typically around 2,500 a day if you're trying to lose weight for most people. And the steps are important, but we focus too much on steps. So I tell people it's these other things. Then I tell people it's to find something they enjoy. Every year I hear people tell me they're going to start swimming. And I say, why do you want to swim? And they'll be like, I heard it's really good. I'll be like, do you have a pool? They'll be like, no. We just said, okay, you're going to drive to a place. You're going to change, you have to shower. That takes a lot of time. Do you have an hour and a half? And they'll be like, that's tough, right? So they're not going to do that. So find out what you enjoy. Maybe you like pickleball. That's a great cardio activity. It's also important, as you said, to have some strength training. So maybe you can add some strength training. That doesn't mean that you have to go to the gym, right? You can do it at home. It can be your body weight. There's a lot of great free online exercise programs that you can utilize. And what we need to do, Matt, is we need to change people's attitude of exercise from it's a like to have, right? Like, I'd like to do it. I'd like to go to the gym, and change it to a must have. Just as you wouldn't take your high cholesterol medication 2 days a week, you wouldn't just do exercise 2 days a week.
That is so important. We can't possibly overstate that. We need to realize that things like physical activity are every bit as important about keeping consistency as medication compliance. And when we have medication compliance conversations with our patients, we're like, you can't only take these very important medications once or twice a week or a couple times a month and expect the same results. But a lot of times that is kind of where we end up with physical activity. It's like, if I remember to walk a couple times a week or once or twice a month, isn't that good? And we have to emphasize this is not a negotiable, but like you said, having the barriers removed. I love that is a part of your conversation with patients. If they say they want to go swimming or they want to go to the gym, having a conversation about how practical that is for you to get up and to go to drive to the place where you're going to get that physical activity can help us realize that a starting attainable goal is typically something that you can do with only a few seconds or a few minutes of prep time. So like you said, with bodyweight activity, if a patient is able to perform squats, perform push-ups, or perform other basic sort of modified bodyweight activities, the time between when they think about a physical activity and they're able to start a physical activity can literally be a matter of less than a minute, rather than I need to line things up and put gas in my car and drive to the gym and get dressed for the gym and everything else.
Push-ups are one of the best exercises out there. And I've had patients that literally could do 1 or 2. And by the end of 3 to 4 months are doing 10, 15 in the morning, 10, 15 at night, and building it up. And they're so stoked about it as well to see.
I love that.
There's no special equipment. There's very few excuses that you can utilize. There's different ways to do it. So that could be the one exercise they could start off with, to have a goal of 25 push-ups in the morning, 25 at night, and take 6 months to do it. But you'll get there if you're consistent.
And it's also really easy to keep track of. The complication of a typical average American going to the gym and working out isolation exercises and trying to figure out whether they're experiencing progression. All of that complication is cut out. If you're like, you can do 2 push-ups today, how many will you be able to do next month and how many the next month? We can all keep track of that. That is absolutely wonderful. What else? What have we not covered? With diet and exercise, we've knocked out 2 of the biggest drivers of chronic health problems in the American population. What are a couple of the things that tend to go by the wayside that we don't tend to think about that are driving chronic health problems?
And we're not going to have enough time to talk about this one, so we might need another conversation, is the quality of our sleep. And especially when you're younger, sleep is the thing that always goes to the wayside. And you figure you'll catch up on sleep later in life. Then before you know it, it's too late and you're having major health issues. So we need to prioritize the importance of quality sleep. And I say that to you as a medical student, soon to be a resident, where that's going to be a real challenge. But you know what? We changed the rules around residency years ago because we knew the importance of the quality of sleep. So that's something that we really need to address.
And what would be a couple things if we're like, hey, 2 things, 3 things I can do that are going to improve my sleep tonight? What would those be?
One of the most important things is to keep a regular schedule, especially when we're young. We tend to go to sleep at all different, times. In some ways, going to sleep the same time, maybe it's 10 o'clock at night and waking up at 7 in the morning and being consistent. And people aren't going to like hearing this, even on the weekends. For the most part, that's a good thing. That's going to help the quality of your sleep. And many of us have sleep trackers to do that. It's also about, despite what we talked about, exercise, not exercising, 2 hours before sleep time because you don't want to be accelerating your heart rate. It's also reducing the screen time that we have, not just because of blue light, which a lot of people are focused on, but more because much of the time when we're on social media or sending out emails, we're revving up our brain, and we really should be quieting our brain, prior to going to sleep. The other big thing that I'd say is, for a future discussion, is the role of mental health. And there is no physical health without mental health. And we don't often realize that. We've known about it for centuries, but we actually haven't done anything about it. And as physicians, we often don't talk about it. Patients often don't talk about it to the quality that they should, but that's something that we need to focus on as well.
And that's a perfect jumping off point for a conversation for next time. Dr. Whyte, thank you so much for chatting with us today about the American reality of chronic health problems and the steps that we can take to change our lives starting today. We really appreciate it.
Such a pleasure talking to you, Matt. And thanks for empowering people with information. That's what we try to do at WebMD, because if you have better information, you're going to have better health.